This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Live in studio, waiting for your phone calls, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem. You've tried, you've applied, you've come up with the same old nonsense. It doesn't work. So let's figure out something that actually can be done about it so you can get rid of the problem, so you can enjoy your life and maximize your health and do the things that that you were designed to do on this planet. Life without limits. It would be a beautiful, beautiful tool, right? So it's possible, and I want you to know that it's absolutely over-the-top possible. I'm reading all the time, and I'm looking at journals, and some of them, I get a little cranked up over and a little cranky, and I start, finding fault and reasons. Some of them I see merit in. And if you really want to get me irritated, talk to me about the Affordable Care Act, and only to the extent and because of its limiting features and facts. Now, having said that, as far as I'm concerned, the whole bill is limited, and it doesn't give you what it said it was going to give you. It doesn't provide the options that you thought it was going to. You were told that you could keep the doctor that you wanted and that you would have access and nothing would be denied and so forth. Well, many of you now are finding out that, in fact, that's not necessarily true. And your doctors also are finding out that they are being hamstruck, if you will, or hamshackled and, hamstrung and all those things that refer to not being able to move around. So, as you read through things, I want you to understand that this is a double-edged sword. When you provide benefits, supposedly, for people, somebody has to bear the cost. But also, when you provide benefits, the question is, can I get them? Is my doctor able to do what he needs to do for my best benefit? And sometimes the answer says, not so much. I was reading a magazine the other day, and then I went downstairs and pulled out an old copy of a book and kind of looked at that. And there's a quotation that kind of fits this whole thing, and I want to read this to you. And I don't usually quote exactly this long of a passage, but nevertheless, it fits properly. It says, "I have often wondered at the smugness with which people assert the right to enslave me, to control my work, to force my will, to violate my conscience, to stifle my mind. Yet what is it that they expect to depend on? When they lie on the operating table under my hands, let them discover the kind of doctors that their system will now produce. Let them discover in their operating rooms and hospital wards that it is not safe place their lives in hands of men whose life they have throttled. It is not safe if he is the sort of man who resents it, and still left safe if he's the sort of man who doesn't." Where do you think that came from? An old quotation from Atlas Shrugged, Ayn Rand. Now, that's years ago, and it depicts exactly what's going on. And, that's obviously in the medical genre, but across the board, your physician can't do the diagnostic testing that would benefit you. Why? Because it's expensive. They can't do the procedures that they would like to do. Why? Because they're expensive. If they were supposed to shift and support you the way that was necessary, they couldn't do that. Why? Because education takes dollars. The reason that we do this program, Dr. Tom Roselle Live, is to empower you. That's why I wrote my book, by the way, Ageless Health. Health is a do-it-yourself program, because it is true that where you are right now at this moment in time is exactly where you've meant to be. Why? Because you are. You're there. And it's because of your hand, the choices that you've made, the things that you've done. So if that's true, why do we continue to look to somebody else or something else other than ourselves to change what's happened to us by our own device? See, if you look at your time track and you look at all those decisions you made, the foods that you consume, the things you've put up with and so forth, you see that there's a trail. There's an absolute why you got to the place that you are right now. So having said that, wouldn't you like the opportunity to be able to really understand what it is? We're going to get into a lot of different things today, but I want to give you that opportunity. See, October the 18th, my Ageless Health presentation is going to be a blockbuster. It's going to be something that's going to give you tools to maximize your wellness, your health, for you to be able to take control of those things that are important, that are critical in your life. It's called your health. And we're going to teach you how to take control of that and how to make a huge difference. So the question that you have to ask, are you ready? Do you really want to, or do you still want to have somebody else do it to you? Do you think that health is about taking a pill? Do you think that health is about allowing somebody else to tell you what to do? Or are you ready at a point of your life now, when would now be a good time to take that first step to get things turned around, to begin to improve whatever time that you have left on this planet? Because the truth of it is, nobody knows how much they got. But this is a day that I promise you, if you take the actions that we laid out, the very next day, you will begin the process of reversing virtually anything. Wouldn't that be cool? What do you think you're going to learn that day? Well, we're going to teach you all kinds of things. We're going to teach you how to not only take control, but we're going to teach you what to do. You get a little older, you get a little stressed out, particularly in the Washington area, and it's like, why did I walk into this room? I forgot what was on my brain. Not because you're losing your brain, it's because you got so many things on your mind, you're burning your brain out. Would you like to get that back? How about, 10 steps to improve cognitive decline? That gut that you have, that bad fat around your stomach, the one that's really bad in the cardiovascular system and the heart? Would you like to know what really happens when you develop that? Would you like to get the tools to fix it? Do you want to know what lab tests that your doctor should be running and have the option of being able to say, hey, why don't you run this? Explain to me why you're not doing it. And how about, I just had a small accident about 10, 15 years ago, but now I can't move. These are important things you need to know. Go online, go to rosellecare.com or go to agelesshealth2014.com and register today. You only have 3.5 more weeks. It's like 4 weeks from yesterday, from Saturday. It's over-the-top presentation. I promise you, you will go away with everything you need to make a huge, huge difference in your life. It's time to throw the pills away. It's time to take control. It's time to get your health back. Join me, okay? Join me and my crew, my staff. Join some very amazing presentations that you will be able to flip things around tomorrow. Let's talk about you. Let's talk about the things that you can do to make a difference. I came across some very interesting data and, things that are very basic. Anytime you deal with a viral component and somebody wants to give you an antibiotic for it, go the other way. Because viruses don't respond to antibacterials. They just don't do that. That's not how you treat them. We can talk about many things. We can talk about, HIV. We can talk about the common cold. We can talk about the flu. We can talk about something called Epstein-Barr virus, EBV, which is the thing that, everybody blames for, I don't feel good, I'm tired, I can't get out of bed type of thing. There was an article that many of you may have read, and it was in the Medical Science Monitor, and it reported the benefits of IV vitamin C therapy. This goes back to Linus Pauling's work, where he actually received the Nobel Award for this. And they found that somewhere between 7.5 grams, that's 7,500 milligrams, to 50 grams, 50,000 milligrams of intravenous vitamin C would turn the stuff around. Almost 100%, about 95% of the study that they did, turn it around. So doesn't that tell you something about the deficiency levels that we have relative to our immunological function? Doesn't it tell you about that we're not getting what we need to get? And then, there's another article that I came across. Matter of fact, there's been several of them. It's like vitamins are worthless. Don't take anything. And there's this anti-supplement war out there. But when you pull the string and you find out who's funding it, the answer is, oh, yeah, now I understand why they're doing that. It's amazing to me how people can take data, flip it around, and do what they need to do. You know, and somebody comes into my office and they say, well, I'm taking multivitamins. I'm taking this. So I ask them, what are you taking? And they tell me different things that they're taking. And I say, do you understand that they're all petroleum-based, they're all artificial, these are all synthetics, and they're really not doing any good? And, oh, by the way, see all these things in it, they're GMO modified. So if you're going to take something, low dose is often better than high dose, and natural organic supplementations are the things that you need to have in your body to make a huge difference. What I'm trying to do is get you to understand that you have to be your own advocate. You're the one that has to really get into the literature, understand what you can do from the basis of preventive medicine. That means your involvement, what you need to do from a exercise point of view. Walk, dance, stretch, little things. Eat well, organic foods. Don't get involved in this stuff. We go back to something that Dr. Oz said, right, and just threw me through the television, said I was about to take it and throw it out the window. He said that there's no difference, don't waste your money, between conventional foods and organic foods. I mean, the man must be smoking something really bad because his brain at that moment in time went out to lunch. If he doesn't understand it, and he is supposed to be the guru for integrative and alternative care on television, folks, you're being duped. You're being led down a line that is ridiculous and stupid. And the thing of it is that we think that if we see it on television, we hear somebody that's prominent say it, if we read it on the internet, God forbid it's true. You have to understand that there are differences in many things. Let's talk about diabetes for a minute. Almost 10% of the population of this country are now diabetic. 10%. That's huge. And it's rising. It's going through the roof. We had an increase of about 3.5 to 3.8, depending on the authors, million more people now today that are diabetic than they were 3 years ago. Why is that? It's because of the garbage, because of lifestyle, because of the things we're doing. We posted on the web, we passed it on. There was this Facebook presentation of something that I've been saying and drawing conclusions to for many years. This young woman had a cell phone, and she put her cell phone in this pocket of her bra, and over a period of time, there was damage, and the damage was very severe cancer. And I've told patients, do not put your cell phones on your body. Hands-free. Do not put them on your body. Whether you put it up to your ear and it breaks down the blood-brain barrier to your brain, so you end up with tumor formations, we know that exists. Why wouldn't you think it would cause a problem with breast tissue? Or, by the way, if you have them in your front pocket, your prostate, guys, or your testicles or your ovaries, why wouldn't you think that there's a problem there as well when we see the evidence across the board that these things are happening? Are we ostrich, or we just don't want to let go of our devices? We sit there with a laptop, we sit there with our iPad, we sit there with our iPhones, we're sitting on our laps, they're sitting on, next to our heads. Why would we not think that it's going to happen to us when it is happening across the board? I just don't understand the intelligence that's wrapped around that vision. Doesn't make sense to me. You keep going through and you look at all these articles, and you're going to find whatever article you want to substantiate your thought process and your point of view. But when things keep coming up and all types of journals show things, like the American Journal of Public Health recently came out with an article, again, on vitamin D and the reduced risk of premature death if it's high enough. So if you get a nice high level of vitamin D, you're not going to die as quickly as somebody else who isn't buying into it. We don't get outside. We work. Somebody goes to bed. At nighttime, it's dark. They get up in the morning, it's dark. They go to work. They travel in the car. What vitamin D? What garbage? What do they put in their body? We're coming up to a break. We'll come back. We're going to answer some questions because many of you are already sitting there waiting patiently, and I will get to you. It's one of those days that I have to give you a thought process, something to think about, so to speak. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio. 888-630-9625. That's 888-630-9625. Love to talk to you. Let's kind of, go behind the veil and take a look at things that you may not have thought about. BC in Fairfax, how can I help you, sir?
Doc, spoke with you 3 or 4 weeks ago about the prostate cancer diagnosis.
Okay.
And I told you we were going for CT scans and everything. You said you'd be happy to review those after we got them back. So we did get them back. Everything is clean from there.
Good.
Now, this has what's known as a Prostavision score of 4.
You mean a Gleason score 4?
Well, no, Gleason, one area is 7 and the other is 6. And then they have what they call Prostavision score. I'm just looking at the documents here. Yeah. So I guess my question to you after we review things, how aggressively should this be gone after?
From whose base, medical or natural? I'm always going to err to what can be done without radiation, without any kind of chemotherapeutic intervention. So if anything can be done on that level, that's the first line of defense. But regardless of what you do, you still have to change the pattern. You need to find out what the actual levels, what the markers are, and so forth. Your Prostavision biopsies and are, it's new to the game, and what they're trying to figure out is the aggressiveness, the size of it, and so forth. But having said that, let's talk a little bit about treatment options. If it's an isolated lesion and you choose to do the allopathic medical route, then you want to do cyberknife. You want to do very localized radiation.
As opposed to the seeds, you think?
Yeah, no, not the seeds.
As opposed to the seeds.
As opposed to the seeds, yes. Because once they put the seeds in, you've got that constant ongoing radiation in your prostate, and it's going to affect other areas, other tissues, period. Think about it. Radiation causes cancer. Why would you use radiation on a constant level, whether it be to treat chest cancer or anything else, ongoingly to kill a cancer when it causes cancer? It's the same analogy I give women when they say they're going to go in for mammography. You're diagnosing a breast lesion using something that causes cancer. So always find out first if it's an estrogen-based type of cancer, then you've got to change the exposures so you're staying away from anything that estrogenic, plastics and the laptop computers that we talked about a little bit, cell phones and so forth. All of those are xenoestrogen producers, and they're going to make things much worse. You want to change the body so the body becomes extremely alkaline. Cancer of any sort of nature cannot progress in an alkaline environment, so you have a better shot at it. You want to get very, very low-level aerobic type of exercise, because that'll begin to turn the body around as well. But again, I need to know much more about that. If it was me and it was invasive, it's getting into the prostate, it's going into the other tissues. One of the places I call right away is American Cancer Hospitals at 1-800-4FOR HELP. They do combination types of therapy, and if you're going to do chemotherapeutics, they do something called a fractionated dose chemo, where the chemo is very specific. It is not an ongoing process. It's lower dosages, and they combine it with many other things. So that would be one area to go. There's a guy down in Houston. His name is Brzezinski, and all he does is end-stage cancers, and the guy is amazing. Stanislaus Brzezinski, and you can look it up. He'll come up. The guy, they're studying his protocols now at NIH. What this guy is about is an amazing story, because years ago he was run out of the country for treating cancer patients, and he had to go into Mexico.
Are you familiar with Dr. Myers in Charlottesville, Fuzzy Myers?
I know the name. I'm not familiar with it. But if you call my office, not just call my office, send me a note, and I will send you 4 or 5 different people that I would go to if I had that problem. Actually, if I had an isolated prostate cancer, I would be doing things very aggressively from a natural point of view. There are all kinds of Chinese herbs. There are low-energy light laser protocols. There's acupuncture protocols. And you would use them in combination. But it's a choice that you have to make, and you have to listen to your physician, see if that makes sense to you, ask the question, what are my side effects? How's this going to leave me? And what happens?
That's what concerns me most, all these side effects.
That's right, and that's what I'm trying to get around to, because sometimes the treatment's worse than the problem. And, most of us will go in and out of small types of cancers repetitively throughout our life. So what I want you to know about that is you have some options. Get a hold of me. I'm happy to guide you through it. It's specific. We're going to talk a little bit about cancer today, so listen to the program, because Breast Cancer Month is October. We're in it, and there's some peculiarities that you really need to know about. So don't go away. Thanks for calling. I really appreciate it, BC. Hopefully I can help you and I can take you through this and let you make the decision along with your doctors that best suits you. Don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you. Listen, if you want to get a hold of me outside the program, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. rosellecare.com. Send me an email. I promise you I'll get back to you. I'll answer whatever questions that you might have on your mind, and if need be, I'll have one of my staff call you and we'll handle it one-on-one. It's important that you have the data to take control of your own life. That's what we're doing for Ageless Health. 2014, Saturday, October the 18th. It's a day that I promise you will be over the top. So register now. Go online, go to rosellecare.com or go to agelesshealth2014.com. Either way, register, save yourself, I think it's $5 registration fee. It's cheap as it is. Listen, you're going to be entered for $1,000 worth of health care. Amazing, right? You're going to receive all the materials that are going to be presented by all the practitioners all day long. You're going to be guided through a how-to process of putting it together. You will go away with an amazing amount of right now information. You'll know the tools that you need to take control of your health. You'll know what to ask your doctor. You'll know how to say, hey, listen, that doesn't make sense to me. 888-630-9625. That's how you find me here. Let's go back and let's talk a little bit more about cancers and why things do what they do. That means, they put you under the radiation therapy, they do chemotherapeutics, and how did you get there in the first place? Our caller before the break has prostate problems, and here's the piece. Prostate tissue and breast tissue are genetically the same tissue. Okay? So that means that they're going to be exposed and there's going to be susceptibility because of the same type of problems. There's all kinds of data that are out there now, and in the integrative and natural community, we've known this forever. Every time I see an article today, I seem to be vindicated on things that I've told my patients forever. And the one that we're talking about right now is that sugars and carbohydrates can kill you, and they do it in a very specific way. So, I could say to you, what does cancer and heart disease and diabetes and all those things have in common? What do they have in common? Well, what they have in common is several things. They're all insulin sensitive. They're all sugar sensitive. They're all estrogenic sensitive. And they cause problems. So in our environment, when we're seeing huge increases in carbohydrate consumption, that's why we have so much diabetes, by the way, that we talked about in the beginning of the program. If you have high levels of carbohydrate intake, you dramatically increase your risk of developing cancers by over 200%. Dramatically, 200%, that's huge, right? And if you have these insulin-like growth factors, there's something called IGF, or insulin growth factor 1. There's an insulin growth factor 2 as well, and they do things that are different. And you'll find these in things that increase tumor size. They also, if somebody, you've heard the term gigantism and acromegalia and so forth. These are increased sizes in the body and so forth. The IGF, or the insulin growth factor, is a culprit here, but it's also one that increases the risk of all kinds of cancers, but particularly breast and prostate. So when you have a combination of these different things, it's exponential in how it will affect you. So you have to be aware of diet. There's been studies for years that says that if you decrease your caloric intake, that you decrease your risk of all these different types of things. Well, when you decrease your caloric intake, you're actually, to do that well, you have to decrease the amount of sugars in your body, because that's where your calories come from. So now you're left with what? Vegetables and good proteins, like fish and chicken, as long as they're free-ranged, and your omega-3s are high and all these things. Good oils, like what? Like olive oil, that's not processed, that's organic. Like coconut oil, that's not processed. Like grapeseed oil. All those things are good for you types of oils. But here's the problem. Americans have such a high consumption of carbohydrates that they dramatically put themselves at risk just because of that. We're too fat. Look around you. Look at the kids. Diabetic conditions are huge. They're soaring. We have all kinds of problems with mental function, mental clarity. These insulin-like growth factors, are the underlying culprit in carbohydrate-stimulated problems. Remember, we're going back to this IGF, this insulin sensitivity, these insulin titer things. There's a huge relationship between these things. And remember, breast and prostate cancer, you're susceptible. There's a lot of things that you can do to help yourself. There's things that you need to take control of. Get your butt out and start walking every day. Get that aerobic activity, that low-level oxygenation into your body. Stop eating the garbage. Make yourself something that's reasonable. Get vegetables. How much? Like minimum of 5 to 7 servings. A serving's a half a cup. That's not a whole lot. Limit your fruit, maybe 1 or 2. Get rid of the high fructose sugars in your diet. Get rid of the sodas. Get rid of things that cause your body to go acidic. We're going to get Sue in here within the next few weeks, and we're going to talk about some of this. But by the way, if you want to hear Sue, she's got a major over-the-top presentation at the Ageless Health Seminar. I promise you, it's incredible. There's things that will lower your risk and blunt the effect of IGF, or the IGF-1. Chromium is one of them. Most of us have low levels of chromium that have insulin sensitivities or receptor site sensitivities. So you need to check to see if that's a problem. Just don't go out and take this stuff. You need to really find somebody who knows what they're doing. Seaweed. We look at the Asians, and they do something very different than we do, and they don't eat like we do. They eat more sensibly. Traditional Asians do. And you go over and I spent 17 days in China, and I really got a glimpse of what a typical old traditional diet was like. And there's consumption of seaweed, particularly in Japan and so forth, decreases the after meals, postprandial blood sugar levels increasing. It inhibits the breakdown of carbohydrates in the intestinal tract, because the faster the carbohydrate breaks down, the greater the risk you have of having a problem. 888-630-9625. That's 888-630-9625. Bernice, hi. How can I help you?
Good morning. I have a question about allergies. I always get allergies in one eye, and they just itch, and one eye swells up. And what can I do to permanently get rid of allergies?
Okay, well, it depends. First of all, it depends on the allergen, what you're sensitive to, and so forth. And let me talk about why things happen to one side of the body, sometimes more so than the other. First of all, you have a redundant energetic system. That means that in acupuncture, we'll take that for example, you have 12 primary acupuncture channels and meridians, and there are 12 on one side and there's 12 on the other. So you can have a deficiency in one side opposed to the other. You have neurological pathways that are redundant. You have nerves that come off both sides of the spinal level. You can have a nerve that's irritated on one side and not being irritated on the other. Then you have muscular balance. So all of these things, they don't happen in synchrony. They don't happen in totality. Sometimes they do, but sometimes they're like what you're describing. They only happen on one side. So if it's the eye, we may be looking at something like the stomach meridian. The stomach acupuncture meridian starts just below the eye. The gallbladder meridian starts to the outside lateral canthus of the eye. The small intestine is on the face as well. The large intestine is on the face. So we would look at the energetics that have to do with those channels, but also then the why is that comes in play. What's causing that system to be irritated? Was there an injury to that side of the body? Was there some type of stress pattern that occurred because of work-related environment or situation? Is there a dietary pattern? And, is there an obstruction in the intestinal tract on that side? Are the nerve roots on that side not firing the way they're supposed to? So you would look at all those things. But, yes, it can happen. So how do you get rid of it permanently? You got to find somebody who does the kind of work that we do out where you are in Arizona. You have to find out, somebody who does apply kinesiological procedures. You can go to ICAKUSA.com, ICAKUSA.com, and then go into Find a Doc, punch in Arizona, and you'll find the guys that do that type of work. Send me a note. I'll refer somebody out to you. Find a good acupuncturist that understands the pattern. They'll do it. But happy to help you in any way that I can, Bernice. But that's the underlying why. But you need somebody to really understand that. If you do, you can get rid of the problem. The Swan Clinic out in Arizona, a guy by the name of Dr. Sheldon Deal, brilliant man, and he is the clinic director, and several docs that work there. They do a combination of all the things that we're talking about. Brilliant doctor. He should be able to unravel this for you. Bernice, thank you very much. I appreciate your phone call. 888-630-9625. Love to talk to you on anything that happens to be of interest in, kind of primary in your life. Talking about things that make you more susceptible. And we know that lifestyle, we know that the things that we put in our bodies, we know that the lack of certain things and so forth. And there's nothing truer when we talk about it. And I'm going to shift a little bit but it's all under the same umbrella. And when we talk about blood pressure problems, we see more and more people with higher blood pressure today than ever before. Why? Because of all the same things that we've been talking about up until now. There's these things that are produced in the body, in the kidneys, in the liver, and so forth. And one that we talk to our patients about all the time is called angiotensin. Angiotensin is like what it sounds like. Angio meaning blood vessel, tensin, tension. And what it does, it causes an obstruction in natural ACE inhibitors in the body and so forth. And what happens is the blood pressure begins to start moving in the wrong direction. Okay, so we have about 1.5 billion people around the world that are at a huge risk for hardening of the arteries. And when you have atherosclerotic hardening, that means that the blood supply can't get through very well. Now your risk of increased blood pressure is dramatic. Why? Because now your heart's got to pump harder to get through these vessels. The vessels are hard and tight, and you just start seeing blood pressure rises. But here, blood pressure is what the leading cause of any kind of cardiovascular disease according to the allopathic community. That's what they say. So let's go to the other side. What caused the blood pressure problem to begin with? Okay, so, and despite awareness of blood pressure as a health threat, there's, only a minority of Americans that are able to handle and manage their blood pressure. Again, why is that? Why do we know what we know about the body and we can't handle these things? And then patients that use medications, drugs, prescriptions, seem to not be able to control their blood pressure. And we're talking about 2 to 3 or 4 different types of medications, but they still can't get it controlled. So what's the deal here? The deal is you. The deal is your body's inability to handle things. Your body's pollution, your body's injury patterns, your body's deterioration because of all the neglect, because of your timeline. Marshall, you have some problems with your nose. How can I help you?
Yes, I'm 52 years old, and about 10 years ago, or maybe 12, but I've 3 times now, I'm about to go to have surgery to have removal of nasal polyps. That began 10 years ago. I've got every 3 or 4 years, I have to go back and have them removed. And it's only on one side. You mentioned earlier about something happening on one side of the brain, one side of the body, and this seems to happen on our right nostril frequently.
Okay, so you want to know the why behind that. Again, it's the same type of thing. The nose is innervated by nerves, by blood supply, by acupuncture circuits, and so forth. And when that takes place, the tissue is going to be more susceptible on that side than the other side. Now, we're coming up to a break. I want you to hold just for a second because I want to pursue that a little bit so our listeners and you get it and know what you can do about it and how to turn this thing around. Because there's a reason why people develop tissues and lipomas and so forth. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We've been in studio right here at the same old place, 12 o'clock every Sunday. You know, we try to make this as interactive and as controversial as we possibly can for you. So tell your friends about the program. And, by the way, here's the rules of the program. Call early. I'm sitting here looking at a loaded-up call screen, and I don't have the time to get to you. It's not okay. I want to answer your questions. Off the air, go to rosellecare.com. That's ROSELLECARE.com. Send me a note. Love to talk to you. Love to respond to you. Like to, get you into the wellness direction and off the drugs and the medication that you're taking. We're here to do that, to help you work with your doctor to make a difference in your life. Marshall, you still there?
Yes.
Okay, let's talk a little bit real quickly because we're coming up to the end of the program. So anytime that you have something on one side, just remember that you have 31 pairs of nerves that come off the spinal cord. Remember that you have 12 acupuncture channels that are paired, 12 on one side, 12 on the other. Remember that the body is divided in half. So things can happen to one side of the body without happening to both. You can have a nosebleed on one side recurring all the time. You can have polyps forming on one side all the time. You can have tissue breaking down on one side of the body all the time. But the answer is you have to find out what is causing it initially. Many people who have injuries to their head and neck and shoulders often will have a one-sided problem. They'll have an eye that it's not firing the way they're supposed to, an eye that tears, or the eye that turns red on one side, or more susceptible. They'll also develop tissue breakdown and sensitivity, so there be it the polyps and any kind of other aberration into the nasal structures, the sinus structures, and so forth. So if you were my patient, the first thing that I'm going to look at is the neurology of the body. I'm going to look at exposures, chemical exposures. I'm going to ask you all kinds of questions about things that that you've done to your body, things that you've put into your system over a period of many years, and even though that you've stopped it years ago. It's like a person who stopped smoking. 20 years later, they still develop lung cancer of someone that the only reason they could get that type of cancer is because they were cigarette smokers at one point. So you would look at those things. There's a lot of things you can do for nasal polyps if they're recurring and you had to go back in and have had them removed, several times. One, balance the nervous system. Then you've got to balance the tissue, make sure that you're not doing, my mantra, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, the junk that goes in that irritates any tissue. And the things that is most sensitive and most predisposed are the ones that are going to react aberrantly. See what the acupuncture channel is. See if there's any of the things that we've talked about, in today's program and we've talked about over a period of time. But that tells me when you've had a thing come back repetitively that there's something that hasn't been resolved, and it has to go to one of the underlying structures and the things that feed that structure. Marshall, I really hope that helps a little bit. Please get a hold of me, and I'll be more than happy to walk you through it. Again, this program is like way too short. I'm sitting here looking at these calls, and I so want to answer your questions, and I can't. But go to rosellecare.com and ask me the question, and I will get back to you personally, specifically, and tell you what you can do, what your options are, and so forth. Want to remind you that if there's a specific topic that you'd like to hear about, all you got to do is let us know, and we're more than happy to bring that about for you and talk about it on the program. We'll get 2-3 people, we'll debate it, we'll do both sides of the issue. That's why we like doing this. We want to educate you as much as we possibly can. I want you to join me and a host of brilliant people on October the 18th. It's going to be a day that I promise you're not going to forget. You're going to go home with more information that you thought was possible. But more importantly, I'm going to show you how to put it into place and make sure that you have the opportunity for wellness. See you next week. Bye. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117. This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.